I'm Marcia, and this is Marisa, my girl. We just had a conversation, and she was reasoning with me and letting me know that she met an HIV or AIDS client. Yeah, one of her friends that she met recently had AIDS, and she was scared to touch him. I was like, touch? No, you can't catch AIDS by touching, right? So what exactly is HIV or AIDS? You want to tell them? Okay, let's go. HIV or AIDS is also called human immunodeficiency virus, acquired immunodeficiency virus. Acquired? How do you acquire it? How do you get it? Exactly. HIV is not caused from touching, right? HIV causes AIDS. So first you have the HIV, and then you end up with the AIDS. And it interferes with the body's ability to fight infection. So when you have a HIV, if you ever catch it or been exposed to it through blood products or body fluids, then you know that sexual transmitted disease. It's a sexual transmitted disease, and you can catch it by having sexual intercourse as well. That's a contact, but not just by regular communicating or touching a person, right? If I have a HIV/AIDS and I touch you, can I catch it? No. Will you be smelly? Not right away. Unless you're having infections, then of course. But let me give you a little more roundup of what it is. And okay, it requires a medical diagnosis, so definitely you have to do blood tests to prove that you have the AIDS, right? Within a few weeks of being diagnosed of HIV infection, which is flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptom includes weight loss, fever, night sweats, fatigue, and recurrent infections. Treatment consists of HIV antiretrovirals. No cure exists for AIDS, but straight adherence to antiretroviral therapy, ART, can dramatically slow the disease progress, prevent secondary infection and complications. With that, it can prolong your life, right? With treatment, it can prolong your life, but it cannot be cured, right? That's what the person told you. They were brave to tell you that they have HIV. You know what I mean? What does AIDS look like? You might have night sweats, as what I say. When it goes to AIDS, you have diarrhea as well. And sometimes you are vomiting, purple or brown spots on your skin, depression and memory loss. Your friend has that? She's depressed? Oh, she's so depressed she wanted to share the information with my girl Marisa. And Marisa was so concerned that she wanted you to know about what HIV/AIDS is. However, it's not a good infection to have, and she said she did the ELISA test. ELISA, is that a person? No, it's a diagnostic screening test. However, HIV attacks the immune system, and it attacks the immune system by destroying the lymphocytes. The virus also rapidly, I'm telling you what I've learned. right? I've learned that now. So I researched it and I'm explaining to her what I learned about this illness. So what's it what it does? You researched it too? Oh, all right then. Maybe on the next video you can tell them. But for now, we have to share this information. T cells help immune system to recognize and fight pathogens. And your normal CD count when they do these tests should be 500 to 1500, right? Okay. All right, if a client's CD count is below 200, client is at risk for what? Opportunistic infections. What are the infections that your friend said she had? Okay, she had oral pharyngeal candida. Ooh, infection, mouth infection? My goodness. Kaposi sarcoma. You can end up with skin cancer with all those brown spots on your skin. Pneumonia, pneumocystis, pneumonia, even meningitis. Oh my goodness. Though it's a serious illness and the end result is death because it has no cure. That's what you wanted me to tell them? Okay. What is the goal of HIV medication? To interfere with the virus replicating. So when you have this virus, you end up with your cells replicating and causing infection, and it decreases your immune system, and you end up with all kind of illness or disease. Imagine someone that is in a late stage of HIV. It is very hard to cope with all those diarrhea and vomiting. You can't keep nothing down, you're losing weight, and you know you're gonna die. That must be very depressing. Which isolation precaution are used by healthcare professionals? Universal precautions. Patients do not have to tell anyone they have HIV and treat everyone. Healthcare professionals, you have to treat everyone like they are infected with the virus. It is a virus indeed. Protect yourself.